In September 2008, a new national strategy for rural sanitation was launched in Indonesia. The Community-Based Total Sanitation, or CLTS strategy, changed everything about the way rural sanitation programs were to be implemented in the country. Decades of hardware subsidies to households have been barred under the new strategy. Starting 2008, government programs may only fund consumer demand creation for sanitation, improvement of market supply of sanitation goods and services, and knowledge management about scaling up sanitation access sustainably. But all this was unfamiliar territory for the government institutions. At all levels, government systems only had experience of distributing subsidy packages. How to go about implementing the CLTS strategy? A learning opportunity presented itself in the form of the TSSM or STOPS project in East Java, funded by the Bill and Melinda Gates Foundation and executed by a partnership between the Government of Indonesia and the Water and Sanitation Program. TSSM offered a technical assistance package for districts to learn how to become open defecation free, using the CLTS strategies of demand creation, market supply improvement, and building an enabling environment for demand and supply forces to mutually sustain each other. The technical assistance package was offered through resource agency personnel hired by the Water and Sanitation Program. One trained resource agency coordinator worked with each interested district to develop local government capacity through hands-on training for a period of 8 to 9 months. The hands-on capacity building model, which was field trialed in all 29 districts of East Java, can be used for scaling up the operationalization of the CLTS strategy in all Indonesian provinces. This video summarizes the district technical assistance process. Step 1. The TSSM project was initiated in each district using a demand-responsive approach. Roadshows in each district explained the conditions of engagement. TSSM technical assistance was available only if the district agreed to adopt a zero subsidy approach and committed necessary budgets for TSSM implementation.
Pemerintah Kabupaten Magetan sangat mendukung sekali dengan adanya program STOP ini. Itu diwujudkan dalam pembentukan Renstra khususnya sanitasi, di mana diharapkan tahun 2014 semua di 235 desa dan kelurahan ini total untuk ODF.
Step 2. Once the district sent a letter of interest signed by the district head accepting project conditions, a TSSM resource agency consultant was assigned to work with the district. The RA consultant helped the nodal agency, the District Health Office, to set up an intersectoral total sanitation coordination committee to ensure a shared intersectoral understanding of the new approaches to be instituted for rural sanitation. Simultaneously, a professional market research agency contracted by the project at the province level carried out consumer research to understand sanitation practices of villagers in East Java and the underlying factors influencing those behaviors. The Market Research Agency also studied what sanitation goods and services were available in districts and which consumer categories they were serving. Based on findings from these research studies, a behavior-changing communication strategy was developed for East Java, along with a menu of communication tools from which districts could choose products to replicate for their use. The market research also helped develop a range of sanitation improvement options, expanding options for poorer consumers for whom existing markets were not offering much choice. Local masons and primary health center sanitarians were trained in every sub-district to actively promote and deliver these options on demand to consumers. Hand washing with soap at key times was integrated into the TSSM communication strategy. Along with the CLTS triggering process, the option developed for improved sanitation facilities and ODF verification systems. District health offices conducted dissemination roadshows at sub-district levels. Sub-district health centers repeated the process to inform all village chiefs about this opportunity to learn how to become open defecation free. Village chiefs were required to send formal letters of interest if they wanted project intervention in their village. They did so in the full knowledge that TSSM was offering no funds or latrine materials.
Satu hal yang membanggakan tentang program STOP di Kabupaten Jombang adalah walaupun kita baru melaksanakan selama 2 tahun, ternyata program STOP ini sudah memberikan dampak yang luar biasa di Kabupaten Jombang. Salah satu dampak yang bisa saya laporkan adalah ternyata dengan banyaknya masyarakat yang sudah ODF, ini bisa menurunkan prevalensi penyakit. Ya. Salah satu penyakit yang menurun adalah penyakit diare. Jadi bisa menurunkan prevalensi lebih dari 50%.
Step 3. Implementation could now begin. The resource agency consultants began to train district and sub-district level institutional staff in demand generation methods. They provided hands-on training in CLTS methods to around 40 local government and partner NGO personnel in every district. Through this training, the RA consultants triggered collective sanitation behavior change in at least 30 communities per district. The trainees then took over the task of triggering the remaining villages. Resource agency consultants continued with follow-up visits to triggered communities. Through these visits, they gradually established community-based progress monitoring mechanisms and connected community monitoring with regular sanitation monitoring by the primary health centers. As communities approach ODF status and claim to have become open defecation-free, the RA consultants helped primary health center staff to conduct ODF verification exercises. These verification procedures have now become institutionalized in East Java's sub-districts. To create a competitive spirit among participating districts and to facilitate mutual learning exchanges, WSP collaborated with the provincial government to organize annual stakeholder learning reviews. These popular learning events provided district stakeholders with the incentive to monitor and report progress and seek support from each other to solve problems and exchange innovations. The Provincial Health Office has allocated funds to continue this annual learning event after TSSM closes in November 2010, and WSP will provide assistance in planning and conducting these learning events.
Program stop? Yes! Yes! Okay!
At the end of the 9-month technical assistance period, WSP's exit strategy consists of providing technical assistance to participating districts to develop district strategic sanitation plans for the period 2010 to 2015. These plans include district vision, strategy, and budget estimates for scaling up total sanitation approaches district-wide. Once the district achieves the first target of all its communities becoming open defecation-free and washing hands with soap, the strategic plan moves on to creating demands for the next pillars in the CLTS strategy: safe food and drinking water management, and safe management of domestic solid and liquid waste. The national government now needs to identify and disseminate feasible options for communities to adopt for these remaining pillars. Just as TSSM has done for the first 2 pillars, elimination of open defecation and hand washing with soap. So, at the end of 9 months of technical assistance, each participating district is left with trained institutional capacity for CLTS triggering in all remaining villages, triggered communities able to monitor and report progress to primary health centers, all sub-districts with primary health center staff able to trigger and monitor community behavior change and report progress to districts. Behavior-changing communication tools based on formative research in East Java. Trained local masons and sanitarians in each sub-district to deliver range of low-cost improved sanitation options. And district strategic plans for scaling up sanitation sustainably district-wide by 2015. The government of Indonesia has committed to scaling up the CLTS strategy to all Indonesian provinces by 2014. Provinces and districts can express their interest and demand to the Ministry of Health for technical assistance to translate CLTS into practice. Along the lines of the capacity building model that TSSM has successfully institutionalized in collaboration with the governments of East Java and its 29 districts. East Java Province, districts and villages are ready to share their learning and capacity for sustained sanitation scaling up with the rest of Indonesia.